nearly 50 years since I was diagnosed. For me, it began during childhood. One day I awoke to prepare to go to school, and my parents didn't know what was happening because I began to vomit. I became dehydrated. Of course, I was taken to the emergency room. That's when I was diagnosed with type 1 diabetes. It was about 2 weeks, almost 2 weeks in the hospital. I knew that what was most important was to follow the instructions from the medical providers. At that time, I would say the doctors and the nurses and the dietitians. I had to check my blood sugar level before every meal. And at the same time, I also had to monitor my ketone levels. I had someone ask me the other day, how did you do that at 12? I don't know, but I had a strong belief and I had a strong faith. As I said at the beginning, I wanted to understand what needed to change and how would it change. And little did I know that I was bringing in something bigger than the problem. I was allowing myself to be open, to be guided. I had to make adjustments to balance, to change. It was always so many things to adjust, so many meds to adjust, so many areas of life I had to adjust, but I had to do it quietly. I didn't have to do it quietly, but I did. Because diabetes, I found, is a hidden disease. There were many complications and it was very complex. And I did not want to overwhelm anyone or to discover that someone else might not be interested. With the high blood sugar levels, it led to high blood pressure. So that meant more meds then. So then I had episodes of hypoglycemia. And when that occurred, I became disoriented, unable to concentrate. Sometimes I was even found unconscious. The high blood sugar levels led to leaking blood vessels in the back of the eyes, which then I had to have a lot of laser treatment. Then what came with that was low vision. Low vision meant I needed low vision devices, which I still use today. The nerve damage from high blood sugars injured nerves in my hands. I've had a lot of, the hand surgery, and I've also have the flow of blood in the legs is also a matter. Now that really has me concerned. Kidney failure came and presented itself. I received a call one day for a pancreas and kidney transplant. And that changed everything. It was a life-changing procedure that slowed the progression of the complications. It was the gift of a second chance, and here's why. It's a story of a mom who had lost her son. She was losing her son. And she said she found a way in her heart to say yes to life in the midst of losing him. But what's so strange about diabetes is that I found it's affected every area of the body, and that is one thing when I consider people who have pre-diabetes and they don't know. Sometimes by the time they know, some damage has already been done. Check the history of diabetes. Check the history of disease and learn about the function of your body's pancreas and kidney. Learn how persistent high blood sugar levels can affect the arteries, the blood vessels, the dental care, the feet. Learn how it's going to affect the hands, the hearing, the memory. Learn how it can affect the muscles, the skin, the vision, and nerve throughout the body. And I would also say, build your knowledge about the condition to understand your choices and to make the best decisions or make better decisions. And I would say get information to help you to understand your lab test results. Be patient. Be patient because your patience and persistence goes well with your well-being. And I basically am so thankful for opportunities like this to serve, and thank God for the opportunity to have had a second chance to adjust, to balance, to change, like we all are grateful for it, no matter who we are.